One of the more common requests today are women who come in who are looking for fat grafting instead of breast implants. Some of those patients are women who've had implants and no longer want them, or experiencing a variety of symptoms and feel like the implants are cause of it, and therefore they want to eliminate their implants as a potential source of issues. So what do we do in that circumstance? Well, most of the time we have to do a breast lift when the implant is removed, but we can also add, and this is often requested, fat taken from another area of the body and placed in the breast. What most women want is upper pole fullness after any kind of breast surgery. They want fullness at the top where it's absent when the breast sags. And sometimes the native tissue, that is a woman's tissue, will support that and allow for upper pole fullness. Other times we need an implant to create that. And sometimes we can use fat grafting to create that, as we did in this patient. We did a breast lift and we added fat in the upper pole. You can see where it's obviously absent in the upper part of the breast here. This is called the upper pole, but much fuller here. Now, it's not as full as an implant would be, and that's perhaps the limitation of fat grafting. Fat grafting can restore a more natural appearance to the breast than an implant typically would, yet it doesn't give quite the amount of fullness that you would see with an implant. So that can be a limitation that some women would say, no, I'd rather have an implant. But it is a great replacement for an implant in circumstances where the implant has been removed, and or it's a great way to supplement the size of the breast when a woman is apprehensive about having an implant or is looking for a very conservative change, such as 1 cup size, and we are using it more and more commonly today. Fat is very safe. It is your own tissue. We only need a source for that tissue, that is an area of the body where some unwanted fat is present, and we can improve that area at the same time. It's perhaps not ideal in the very thin women who doesn't have any extra fat that can be used for fat grafting. So, but most of the time we can find fat in some place on the body that can be the source of grafting for the breast. And like I said, we typically would put it in the upper part of the breast where it's more difficult to obtain that kind of fullness without either fat grafting or an implant. Many patients will ask, well, how much of the fat that you put in is going to stay around? And there have been some studies with it, yet there is an unpredictability factor that we can't guarantee. And we feel that about 60 to 70% of the fat that we place will stay. Now, what are factors that affect that? One is the volume of fat that you place in a confined space. If we are placing fat in a space like the breast, we have to make sure that we're not overwhelming the breast with fat, where the fat cell is not, if you will, sitting next to a normal cell where blood vessels can grow into the fat and help it survive. So it's important to be relatively conservative with the amount of fat that we place in a confined space so that we can enhance the take of that fat. And if it's done that way, I think 60 to 70% of the fat will stay around. So for this reason, I prefer doing fat grafting when the goal of the procedure is to enhance the breast or add no more than 1 cup size to the breast. If it's 2 or 3 cup sizes, it really is necessary to use an implant.